So Joseph Daumal is the physician that's actually not necessarily discovered, but actually has discovered the antibody for NMDAR receptor encephalitis. And so he published 577 cases of this now, accumulated over about 5 years, and actually showing now follow-up of up to 2 years with some of these patients. And so this is the largest cohort published, and what he very nicely does is show you the presenting symptoms of folks with this. And one of the things that's most striking with this is that it can really affect all age groups. You can see children, the range of this study was anywhere from 8 months all the way up to 85 years. And although the predominant group are female between the ages of 12 and 45, there is a spectrum that you can really see over all ages. When you look at adults and children, the initial presentation oftentimes is going to be a little different, with adults predominantly presenting with psychiatric symptoms. And as again you saw in Susanna's story, psychosis can be a major presenting symptom in that, and that these folks often will have very vivid hallucinations, paranoia, irritability, confusion, and so the psychiatric symptoms can be very, very striking. But along with that, you often will see things turn a little bit, and they often will develop other symptoms that will kind of oftentimes serve as a clue that something else may be going on. Now, these other symptoms actually often are the presenting symptoms in children, and so particularly seizures and movement disorder are very, very prominent symptoms in the pediatric population and often present first, whereas in the adult population, the psychiatric symptoms are often the first symptoms to present. That being said, if you look at all of these symptoms over the course of a month, by that 1 month mark, at least 4 of the symptoms that you see listed on the slide here are present in almost 90% of the patients. And so there are some things that we can really think to focus in on in terms of looking at the symptoms that can kind of help us maybe identify these patients from other patients with psychiatric illness. And so the predominant factors that we talked about are behavior, but also cognition. So drops in their cognitive performance is definitely seen. Memory deficits, language regression. So is often a big one that you will see, not only perseveration, but particularly even progressing to aphasia, where they actually have loss of speech completely. Seizures are prominent, and there are multiple different seizure types that have been reported in terms of partial onset seizures, generalized seizures, myoclonic seizures, all varieties. And movement disorders is very prominent as well, which can be tricky. And if you think of a lot of these patients being placed on antipsychotics, which movement disorder is a very common side effect of, you can see where that particular symptom may be overlooked. But keeping that in mind and really delving into whether that was present even before the onset of medications. Decreased level of consciousness is something that you often will see. And then there's some other symptoms like autonomic symptoms or central hyperventilation, ataxia, hemiparesis, which occur less commonly, but again can serve as kind of red flags if you see these things occurring. So if we can go to the next slide, please. So take-home point number 1 is going to be that patients with autoimmune encephalitis often are going to present with psychiatric symptoms, and these may be mimicked by mimic schizophrenia or bipolar disorder. And the next slide. And so if these things are present, these should really serve as red flags. So if you are seeing seizures or have behaviors that are concerning for seizures, and you really oftentimes may have to ask, because it may be subtle, are there repetitive behaviors that are actually the patient is doing over and over again that would suggest that they're actually having these types of things. They may not just jump right out at you. They may not be necessarily generalized tonic-clonic. And oftentimes they're going to be more complex partial. Is there cognitive delay? Is there a language regression? Decreased overall consciousness? And much like we saw in Susanna's case, is the neurologic exam abnormal? Is there findings that would suggest that this is something more than just hallucinations and psychosis? That there actually is some other indwelling pathology going on? All of these red flags should then warrant further evaluation.